The next presenter is one of our scientists, and his name is Elijah. So Elijah, introduce yourself properly and tell us your topic and give us your presentation.
Good day, everyone. My name is Elijah Asupo Ekon. I'm a student of Bioscird. I would like to welcome our director, our guests, and all my colleagues. You are welcome to a seminar.
Thank you.
Today, I'm going to be talking on a seminar topic, parameters in urinalysis and their health implications. So before we move further, what is urinalysis? Urinalysis can be defined as a test used in indicating illness. Illness like bacterial, kidney damages, infections, etc. And some substances like urinary tract infection, tumors, and so on. So with the help of urinalysis, we can see that we can pinpoint the illness inside us, because there are some illness inside us that are invisible, our eyes can't see. But with the help of urinalysis, we can help detect our problems, our issues. So we move further to say urine colors and their interpretation. There are some urine one should have. What are the normal urine ones you have? We have the amber color and the light yellow. Those are the important and the reasonable urine a human should have. So I'll also move further to interpret and tell us the interpretations of their urine one after the other. If someone have cloudy urine, what does it mean? It means an infection. The person is infected, he has an infection inside. If someone urine is dark, or should someone urine be dark? No. If someone urine is dark, it means dehydration. If someone urine is cola color, it means liver diseases. I'll now move to erythrocytes. If someone have erythrocytes in the urine, is that normal? Or is that how someone's urine should be like? No. If someone have erythrocytes in the urine, it means UTI, tumors, injuries, etc. What's the meaning of UTI? UTI means urinary tract infection. We have foamy urine. If someone's urine is foamy, what does it mean? It means that the person have a high density of protein in his or her urine. So you can see some people may say, I'll use my urine to know what's my problem, but no. We have urinalysis. Urinalysis test can help us pinpoint some bacteria inside us. So you cannot just say that you know your problem when urinalysis test is there. No matter how you know it, you'll not be that perfect. But urinalysis test will help us detect and preview our sickness. So we'll move further to factors in urinalysis. Factors that change one urine, that can give urine a particular color. What are those factors? Factors like food, medications, and so on. Like a drug like rifampicin. Rifampicin can change one's urine to be reddish. That is a medication. Vitamin C, excessive of vitamin C can change someone's urine to be greenish. So as a human, we need to know what we take in. We need to know the kind of food we eat. We need to know what we take in our body. The parameters in urinalysis and their health implications. As a scientist, you need to know the parameters, how to interpret it to someone. Even when you are treating the person, they might ask you some questions. So as a scientist, you need to be able to explain, to interpret to your client. pH. If someone have pH, if pH is present in someone's urine, what does it mean? It means that the urine is too acidic. And we have the range of pH. The range of pH is from 5 to 7. If it is above 5, it's too acidic. If it is above 7, it means kidney damages. So this is a process whereby urinalysis tests help us to detect, to show us our problem. If someone have glucose in the urine, is that right for someone to have glucose? Glucose means the person has diabetes. And we also have ketones. What are ketones? If someone has ketone in the urine, it indicates that the diabetes is in a high tendency rather. If someone has protein, protein also signifies and indicates that someone has kidney damages and so on. If someone has nitrite in the urine, it indicates an infection. If someone has blood in the urine, it indicates bleeding. It indicates kidney damages also. If someone has leukocytes, that is also an infection. So all these parameters are here. The scientists have gone for research and brought out urinalysis test. So to me, I think this is a good idea that the scientists brought up the process of testing humans to know their problems and to detect, to tell them what's wrong with them. Because there are some bacteria inside that our eyes cannot see, but with the help of urinalysis, we can help pinpoint. How about urinary? Urinary, if someone have urinary in the urine, it means hepatitis and also liver disease. If someone have bilirubin, what does bilirubin mean? It means liver disease. So all these parameters are active to tell us our problems. As humans, we need to have some tests, we need to carry out some tests to know what is wrong with us. So I would like to thank the scientists for having some research about urinalysis. I see this is a nice idea about them. I will thank them so much. So this is the function of urinalysis, and this is what urinalysis can help us to do. So I want to thank everyone for giving me a privilege, their attention, spending their time to come and listen to me. I want to thank everyone. Thanks a lot. Bye.
Okay, we missed one or two questions based on what he presented. And let him answer it. If you cannot answer them, I will help. Do you have questions?
Yes, I have a question.
Okay.
My name is Jessica Utsayo, and my question has to do with, as a pregnant woman, I need to find out what should a pregnant woman avoid taking before doing this urinalysis test? Or do a pregnant woman have to eat before doing the urine test? That's my question.
To my little knowledge, I think a pregnant woman should not take anything when doing the urinalysis test, because there are some food, some medications that a pregnant woman should not take. A medication like diclofenac is not good for a pregnant woman. So I think when pregnant women are to do urinalysis, they're not supposed to take anything at that time. Thank you.
Okay, let me fine-tune that answer. I think it's very correct saying pregnant women should not take diclofenac. They should not take aspirin, all those NSAIDs. And these chemist people can give a pregnant woman who is complaining of pains. They can give diclofenac. Diclofenac can trigger bleeding in pregnancy. A pregnant woman might come and say, oh, I have pains, my waist, my this, my that. Okay, diclofenac is for pains, just give, no. Then if a pregnant woman wants to do urinalysis, there is no law that they don't take this, don't take that. We just collect the urine and test it. One of the things they look for when the pregnant woman does urinalysis is if there is protein in that urine. Protein should not be in a pregnant woman's urine. If it is there in excess amounts, it's a warning sign. It's a serious matter. We call it proteinuria in pregnancy. It's something that needs expert management. It obviously means that something is wrong with the baby in the womb that can put the life of the mother at risk. So urinalysis is a routine test that people should do just to see how their system is working. Thank you. Any other questions?
Okay, can I come in there?
Yes.
In general, urinalysis test, I think it's supposed to be the first urine in the morning when you've not consumed anything, be it water, be it salt. And it has to be the urine in between. Like, while going to eat yourself, you pee the first set, you hold on, then you pee into your sterile cup, then you continue and empty the bladder. So it's the one in between.
You call it midstream.
Midstream, yes.
Midstream urine.
Midstream urine. That's the one that's very suitable for it.
Thank you very much.
Do you have any other question or contribution? If there is none, let's put our hands together for him. Thank you very much. Now, the more you make presentations like this, the more you become confident to talk. There are many chemists in town. All they want to do is to sell to you. Ask them questions for where? They don't want to talk, only to cut and give you drugs. These ampicles you are giving me, gram positive, gram negative, for where? They just tell you go and use it. Should I use it on empty stomach or after food? They just do any. No. So the more you search for information, you read it, and you are ready to present to some person, the more confident you become. That's one of the objectives of this kind of a seminar we are doing here. So once again, thank you very much.
Thank you, sir.
God bless.